play ball like a girl!
What did you say?
You heard me.
Hell yeah! Hell yeah!
Hey, Truth Seekers, I know you've been sitting back just hoping and waiting that there's a candidate out there that will finally give us what we've all been clamoring for, and that's Medicare for all. It will solve all of your problems. It will make your wildest dreams come true. But there are still some naysayers. Some people have not been retrained, have not been gulagged, and they're still fighting for the backwards, cost-ineffective system that's leaving thousands of people dying in the streets. I have one of these guests here today. Please try to suffer through listening to these backwards ideas of just having market healthcare system and making sure that the best healthcare system in the world continues to perpetuate and help people live healthy lives. Ms. Sally Pipes is the CEO and Thomas W. Smith Fellow in Healthcare Policy at the Pacific Research Institute, and she's been there for almost 30 years. She's Canadian and an expert on healthcare. She's learned more. She's forgotten more about healthcare than most of us will ever know. Ms. Pipes, great to speak with you. How are you?
I'm well, thank you. And thank you for having me on your show.
There are going to be some naysayers. There are going to be some people that say Medicare for all is the future. Your new book, False Premise, False Promise, which is shot to #1 on Amazon in its category, says that is absolutely a disaster in wait. Where should we start?
Well, I think we should start by defining what Medicare for all or single payer is, because a lot of people don't understand what it really means. And single payer or Medicare for all means that all private coverage would be outlawed and everybody would be in a system that is run by the federal government. The only two groups that would still be in existence would be the Indian Health Services and the Veterans Administration, but everybody would be covered by a government program, no private coverage. And if you look at the polling from Kaiser Family Foundation, Gallup, etc., people have no idea. People think they would be able to keep their own coverage, and this would be for other people, but absolutely not. It's designed upon the Senator Sanders has designed his Medicare for All plan based on the Canadian system, which means no private coverage for anything considered medically necessary. And Senator Sanders has even added more items to his Medicare for All plan, which Canada doesn't have. So we'll have even more longer waits, more ration care, higher taxes, and a doctor shortage, just as a few examples.
There are many people out there. So first off, for those interested in reading the book, go pick it up. I'll put a link in the description. It is only about 110 pages. I'm not a great reader, and I finished it in 2 days. It's fantastic. You kind of run through some things that I wasn't familiar with. So if it's okay with you, I'd like to start there. You talk about the history of healthcare in Canada and the UK. And for those, so I'm not 40 years old yet. I wasn't around when those things happened. And we take it for granted now that Canada and the UK have them. We hear about them ad nauseum when someone says, hey, you know what? Canada has free healthcare and Cuba has free healthcare. And you can go to Scandinavia and get free healthcare. You're Canadian. You were around back then. Kind of take us through how it happened, how quickly it happened, and why we shouldn't let it happen here.
Yes, well, it started in Saskatchewan by a premier named Tommy Douglas, who came from Scotland, and he started by, in the 40s, nationalizing the hospitals. Then he moved forward in Saskatchewan to nationalizing the doctors. The doctors had huge demonstrations against it, but in the end, they broke down, and single-payer healthcare started in Saskatchewan. It moved across the country. By 1984, the Canada Health Act was passed, which meant that there would be no private coverage allowed. Everybody would be in the Medicare system. Each of the provinces would manage their own healthcare systems. The feds would send transfer payments to each of the provinces, of which there are 10, and then the provincial governments would pay the doctors. Doctors in Canada are private entities, but the issue is there's only one payer. So if you're an ophthalmologist or a neurosurgeon or whatever, you have to submit your bills to the provincial government. Each of the provincial governments sets their own budget for what they're going to pay for healthcare. So my cousin, who is an ophthalmologist in Vancouver, by late November, the budget for him to do his cataract surgeries and other procedures is finished, and so he cannot get paid. So he takes a vacation for the month of December until his new budget starts in January. back in 1993, when the Fraser Institute, where I worked, published its first version, Waiting Your Turn, a guide to hospital waiting lists in Canada. And we had started this in 1988, and the first study came out in 1993. The average wait in Canada from seeing a primary care doctor to getting treatment by a specialist in 1993 was 9.3 weeks. That's just over 2 months. Last year, 2019, the average wait had grown to 20.9 weeks. That's over 5 months. Wow. The average wait for neurosurgery, 33 weeks. For an MRI, it's over 11 weeks. Canada has 16 MRI machines for every million patients. The United States has 44. Lithuania even has 24. So you can imagine what this means. And doctors, of course, many doctors have, over the years moved to the United States to practice the kind of medicine that they were trained for.
So there's some really staggering stats in terms of defining healthcare. One is a right, which this still frustrates me because they don't extend that to its logical conclusion. You talk in the book about if they're able to regulate healthcare as a right, then they have a right to tell you how you can live. And I think it's on page 10. You said that in the UK they have calorie caps, so they can actually tell restaurants what they can and can't serve. The British imposed a soda tax, and I wrote a little note here on the side of what comes next. You got sugar, you got calories, you got tobacco, which is shame now, used to be very popular. Alcohol be next, then exercise. And I interviewed, I don't know if you know Dr. Sean Flynn. I'll link to that as well. I interviewed his experience with the Singapore health system where they self-incentivize to stay healthy. But then I started thinking about other things. What if you're gay and they determine that the gay lifestyle, whether you're born that way or not, is unhealthy and you're going to die? I mean, where does that road lead? So talk about healthcare as a right, and also please talk about the cost explosions that happened in Medicare once it was instituted here. Right.
So Senator Sanders and actually all of the candidates in that first debate, when asked, is healthcare a right? They all said, yes, it is. The issue is, wouldn't it be, if healthcare is going to be a right, wouldn't it be more important first then to have food as a right? Because if we don't have food, we can't survive. So this whole idea of whether healthcare is a right, we're entitled in this country. We have a right to life, liberty, and the pursuit of happiness. We have the right to access the kind of healthcare that we want. But, healthcare is a good and a service. And like all goods and services, it's necessarily scarce. So if we declare a right to healthcare, that is meaning unlimited demand for healthcare, it doesn't necessarily mean there'd be an unlimited supply to meet that demand, i.e. look at Canada and the UK and their long waits. It's also, what does a right to healthcare really mean? Does it mean the right to top-notch care, or does it mean the right to equal care? If it's the right to equal care, does the government then have the ability to ban people from paying for better care, which is the case in Canada? And does the right to healthcare come with any duties? If I have a right to healthcare, does the government have the right to tell me to keep myself healthy, as you were mentioning earlier? Do I waive that right if I'm a smoker or if I'm obese? And that isn't hypothetical. In the UK, certain patients are only eligible for certain procedures if they lose weight or they quit smoking. Otherwise, they're denied that kind of care. So, we have to be very, very careful. The American people would not want the government to totally control their health care and tell them who is eligible for care and what treatments, what procedures they can get, because there will be waits, because the government will determine how much money is going to be spent on health care. And of course, Senator Sanders and Senator Warren, House Member Pramila Jayapal up in Washington State, who's a huge proponent of Medicare for All, when they're asked, well, if the government fully takes over the healthcare system, what happens to all the people that are employed in the health insurance industry? And of course, they say, well, about 1 million people would lose their jobs.
Sure.
Well, but Senator Warren said, well, they can get jobs in auto insurance or in life insurance. These skills are not transferable. Sanders says he will set up a government program to retrain these people, which of course will cost a lot of money. And if you look at the Iowa caucuses and the bungle that the Democrats have made over the caucuses, do you want these people to totally be in charge of running 1/5 of our economy, all of our health care? I think it would be a disaster. And who wants to work for what kind of people would work for the government to pay claims, to manage the whole system? It would be a disaster.
Yeah, after seeing what happened in Iowa, I thought, man, imagine if instead of just counting votes, they were trying to figure out how to get someone a heart transplant. Sign me up. Sign me up. A couple things you mentioned there to unpack. One, I'm not going to be able to remember all of them, but I'm going through some of my notes in the book. Something else that I learned when reading it was the constitutional case in Canada of the gentleman who said he had a right to leave. I believe it was in, what's the name
British
of the
Columbia?
French province? I thought it was the French province.
Quebec.
Quebec, where he said he has a constitutional right under the charter of Canadian health insurance to get the health care that he needs, even if it's outside the system. And he eventually did win his case. Didn't know about that. Can you elaborate on it a little bit?
Right. That was the case of Dr. Chaouli in Quebec, a doctor. And Dr. Chaouli found that the Quebec government would not pay bills for patients that he saw outside of his registered office. So he sued in the Quebec court and then the Quebec Supreme Court and lost. But in 2005, the Canadian Supreme Court took the case and actually won. Dr. Chaouli won. Madam Chief Justice Beverly McLaughlin of the Supreme Court, who announced the ruling back then, said that access to a waiting list is not access to health care. And so, the ban on private health insurance was against the Canadian Constitution, the Charters of Rights and Freedoms. And so it opened up the situation in Quebec, but it has been very sticky and it hasn't really worked. There's a case in British Columbia by a friend of mine, Dr. Brian Day, an orthopedic surgeon, who runs the private Cambie Surgery Center. He is being sued by the British Columbia government, and this case has been going on for 10 years. It has been in the BC Supreme Court for 3 years, and the provincial government keeps putting more and more money into lawyers to extend the case. Brian Day has to raise his own money to fight the case, which he's raised millions of dollars. But imagine the stress and strain of trying to fight the BC government in the BC Supreme Court for the right to open up your clinic to more people to give them private coverage. And he has been running this clinic, and even members of the more socialist party use his clinic, and yet they want to deny British Columbians from having this type of care. The decision should come down fairly soon. The judge in the case, Judge Steeves, had a heart attack, unfortunately, and so it's sort of on hold for a couple of months. But I mean, it's really a shame. We have all these people in Canada and British Columbia, all of the provinces on long waiting lists. These people can't get care. Someone like Dr. Brian Day and his Cambie Surgery Center can take the pressure off the waiting list on the government program and give people an option. The recent number, there are 37 million people in Canada, fewer than in the state of California. And yet, 608,000 Canadians have crossed the border to come into the United States to pay out of pocket for MRIs, CT scans, hip replacements, knee replacements, heart stents, because they feel that wait put on by their provincial government is too long.
And you talked about what happens if the government gets put in charge of the Iowa caucus, and the Elizabeth Warren comment that, these people can all just be displaced and move somewhere else and retrained. And I thought the amount of disruption that would cause in the life of someone who feels like they have a pretty stable job and a way to earn a living. But that's on both sides of the equation. You talk about the unlimited increase in demand with Medicare for all and the real hard numbers on what it did in Canada. And then you make some predictions about the United States. And I think this is really key because I've told people, imagine Medicare for all 10 years from now. And to do that, you have to understand what happened when Medicare actually started. So I'm going to throw a couple things at you and you can tell me what you want to respond to. One, you said the disruption of Medicare would cause about 250 million people to lose their health insurance. You argue that I think it's around 18 million people, I could have the number wrong, that are not currently insured, maybe 30 million. There's a giant percentage of them that qualify for subsidized care that just haven't applied. You throw out the Obamacare healthcare.gov stat that they only had 6 people apply on day one, and they had to go out and petition people to get signed up for healthcare that didn't want it. And you also talk about the runaway cost explosions in Medicare, far beyond what was budgeted. And you also talk about the shortage of hospitals and some of the other disruptions that it caused when Medicare came in, and the fact that Medicare and Medicaid are probably going to go bankrupt by my 50th birthday. So kind of help us understand what the world looks like in a Medicare for all environment once it's instituted under Bernie Sanders.
Right. So there's a lot there.
Sure.
First, I'll say that Senator Sanders agreed with Charles Blehaus of the Mercatus Center, RAND, and the Urban Institute that his plan would cost between $30 to $40 trillion over 10 years. Recently, of course, he came out and he told Norah O'Donnell on CBS Evening News, well, I just don't know how much my plans are going to cost. But we do know they are going to cost a lot, and probably, so that would be the increase in federal spending. The total cost of a takeover of our healthcare system would be about $60 trillion over 10 years. And, Senator Sanders, when asked, well, how are you going to pay for that? I mean, he has said there'd be a new 4% income tax on anyone earning over $29,000, a new 7.5% payroll tax, taxes on the wealthy, taxes on large financial institutions. But he also said that doctors would have to be paid at Medicare rates, which are about 40% below what doctors get paid for treating patients with private coverage.
Super.
My own OBGYN, who just retired, he couldn't take all the paperwork and the regulations and mandates. He just retired. But he said that he lost money on the Medicaid patients. It's called Medi-Cal in California. He barely broke even on his Medicare patients. So he made his salary through treating people with private coverage. There's no question, if the government fully takes over the healthcare system, if Sanders became the president and the Democrats held the Senate and the House, the doctors would be paid 40% below. And this means that a number of doctors currently, who are specialists in particular, would retire early. And we've already seen, according to the American Association of Medical Colleges, that by 2032, there already will be a shortage of 122,000 doctors. I think even more important is the fact that in this country, the best and brightest young people are the ones who apply to medical school and go to medical school. If these students find out that they would be civil servants, public servants, their pay would be reduced, they would not go to medical school. So we would really reduce the quality of the doctors that come out of the medical schools. And over time, this would be a serious problem.
Yeah, anecdotally, I have a client that I met about 2 months ago who is a very, very successful doctor. He owned a series of urgent cares when he got out of the practice, and then he actually developed a system by which places like Costco could do essentially forensic analysis for foodborne illness patients. And I said, hey, I got a question. My oldest son's 9 years old. What do you suggest I tell him to do? And he looked at me and said, do you want me to tell you if you should be a doctor? And I said, sure. And he goes, I can't repeat what he said on my show, but he said, absolutely not, in the most emphatic way that he could. And I asked why. He said, they've basically destroyed the healthcare industry. And he goes, and in 20 years, it will not look anything like it does today. He goes, I would run like the plague is coming at you from being a doctor, especially if he's really smart. And then we joked about how all the smart young people today want to be hedge fund managers. And I have two young girls I know that are valedictorians are going to be actuarials, right? And I just thought it's really a shame that in 20 years to think that these people will be chased out of medicine under this guise that Medicare for all is automatically going to solve all of our health problems. It's a little bit more dynamic than that. And then also in the book, you mentioned that in the first year that Medicare started in 65, hospital costs increased 22% in 1 year and then went up 14% every year for the next 5 years. I mean, if we extrapolate that to today's healthcare costs, essentially, would the system collapse in 10 years? I mean, would it be like climate change predictions? We have 10 years left to get a doctor and then it's all over. I mean, what would it look like?
Well, exactly. Medicare and Medicaid came into being in 1965 under President Johnson and his Great Society. And of course, the Congressional Budget Office wasn't around back then, but President Johnson was heard telling some of his people that it's a good thing that we don't really know the cost of taking over the Medicare program and Medicaid, because people wouldn't have voted for it if they knew what it was going to cost. And we know today there are about 60 million people in this country who are on Medicare, and it's interesting that 1 in 3 new Medicare eligibles cannot find a doctor because of these low reimbursement rates. We are spending about $700 billion a year on Medicare and a little bit less on Medicaid. But the Medicare trustees have said that Medicare Part B would be bankrupt by 2030. And so, these are dire numbers, and it's a very costly program. But the interesting thing is, as I said, 1 in 3 new Medicare eligibles cannot find a doctor. Most people, over 30% of people on Medicare today, either buy a Medicare Advantage plan, which there are many options on Medicare Advantage. It gives people a private option to cover things that aren't covered under Medicare, or they buy a Medicare supplemental plan so that they can get reimbursed, so that doctors can get reimbursed at a rate that they will take these patients. So the outlook is very, very depressing for us as Americans if we get Medicare for all, because even Medicare Advantage or Medicare supplemental plans would not be available under what Senator Sanders, what Elizabeth Warren has backed away from her Medicare for all plan to promoting the public option, which would be a government insurance plan that would compete against private insurers. Ultimately, private insurers would be crowded out. And so it's really a stepping stone approach to Medicare for all. And I think the American people need to realize what Buttigieg, what Biden, what Warren, they're talking about is just slowing down the process of getting to Medicare for all.
I don't know if you saw that clip. I saw it on Twitter this week of Elizabeth Warren stepping behind her assistant when she got off the private jet. Did you see that by chance?
No, I didn't.
She gets off, sees that someone's recording her, and she kind of drafts like NASCAR. She drafts in behind one of her aides so you can't see her. And I thought, this will be what happens when we have Medicare for all. She'll be going to a proper surgeon or doctor, and she'll see the public and go, I'll just slide in behind one of my aides so no one can see me. I thought that was pretty, it was hilarious. It's very Elizabeth Warren. There is an interesting sentiment that you wrote about in your book when you talked about the rise of the NHS. I have one uncle who's from Britain, and a couple of years ago when I asked him about the NHS, he said, it's a pretty good system. We like it. We like it a lot over there. And it is funny that you talk about this sense of national pride that they have. And I was reading about the Beveridge report, and specifically the document entitles, quote, 5 giant evils that the British government should set out to slay: want, disease, ignorance, squalor, and idleness. And I thought, this is so British. And I just thought, why is it that people over there think their system, look at our system and think theirs is so wonderful? And one of the examples I want to give is the story of Anya Humphrey that you tell in the book, which is actually a Canadian example, but they overlap pretty well. How do they go through? Do they just have to experience this personally to realize how screwed up their system is? Or is it because they've had it from cradle to grave, and so it instills this sense of national pride? I'm not from Canada, so I really don't understand it.
Well, if you look at the National Health Service, which will be 72 years old this coming July 5th, Britain does not have, it has a universal coverage system. They do allow private health care, and about 10% of Brits have private health care, and more companies are moving that way. But the system has been in financial distress since it came into being in 71 years ago. Massive sums of money are spent, and yet there are long waits. There are over 4 million Brits now on a waiting list trying to get treatment. They've had to get rid of their 4-hour ambulance waiting times because they haven't been able to meet it. They have a guideline of 62 days of waiting to get cancer treatment once you've been diagnosed. They haven't been able to meet that goal for over 5 years. At the same time, though, it's treated as if it were some sort of a sacred institution being immune from criticism. Right. Margaret Thatcher's former Chancellor of the Exchequer, Nigel Lawson, said, "The NHS is the nearest thing to a religion that we have." But in The Guardian, it was said recently, the writer said, "The National Health Service is the world's best healthcare system. The only serious black mark against the NHS is its poor record of keeping people alive." So,
that's a real quote.
That's a real quote. And so, and there in the UK, there's a shortage of over 100,000 doctors, nurses, and people who work in the healthcare. They tried to pay money to get doctors to come back to the UK, and they absolutely said not. Look at frontman Mick Jagger of the Rolling Stones. When he was diagnosed last year with having some heart problem, he didn't go back to Britain and have his heart valve replacement under the National Health Service. He had it done at the highly prestigious New York Presbyterian Hospital. And his younger brother said, "Thank goodness that Mick do not have to go to the UK and be on a waiting list under the National Health Service." I mean, these are things that American people need to know. Michael Buble, the Canadian singer from Vancouver, where I'm from, when his 3-year-old son a couple of years ago was diagnosed with liver cancer, they didn't stick around Vancouver waiting to see what kind of treatment he could get under the BC Cancer Agency. They went to Children's Hospital in Los Angeles. Of course, they had the money to pay for it. And he had his treatments there. And as Michael Buble said, he had the very best specialists. And today, he is cancer-free. Where would we go if the government fully takes over the system? We have long waits for care and ration care. My own mom died from colon cancer because as a senior in Canada, in Vancouver, she couldn't get a colonoscopy. She got an X-ray, but she couldn't get a colonoscopy because her doctor said there are too many younger people with issues that are on the waiting list. She finally got a colonoscopy at Vancouver General Hospital 5 months later when she was hemorrhaging, and she died from metastasized colon cancer 2 weeks later. If you ration care, it is cheaper, but the American people do not want to have to wait for their health care, be denied care, and then end up not surviving when there's so many great treatments for cancer and various other diseases today.
And I believe that, is it the NHS or the Canadian healthcare system that has a rationing board? I don't recall which one it was from your book.
Well, Britain does through NICE, the National Institutes for Healthcare and Clinical Excellence, where they decide, NICE decides under their quality adjusted life years, what is the value of my life? Say they determine that as a senior I'm worth $35,000 and the latest new cancer drug costs $45,000. Well, I wouldn't be eligible for it because you have to keep the cost down, and this is a way to ration care.
There are a myriad examples in here. I mentioned the Anya Humphrey, which I'd like you to tell that story because that was the first one I recall reading. But you have 2 whole chapters about horrors of single-payer insurance relating to wait times, relating to cutting-edge treatment being not available under the system, as well as technology, and of financial costs. So in 3 whole chapters, I'd like you to pick the story you want to share, or stories, rather than have me pick mine, because there were so many good ones in here.
Oh, well, I think particularly the case of Miss Shemblaw from Ontario, who was diagnosed with leukemia. And when she went to the doctor in Ontario, she had some treatment. Her cancer went into remission, but she really needed a stem cell transplant, which they said she could not get. They said if her cancer remained in remission, they actually would send her, the Ontario government, to the United States, and she could get the stem cell treatment. It took so long for the Canadian government to get this approved that when she arrived in the States and her daughter took time off work, her cancer had returned, and therefore she wasn't eligible for the stem cell transplant. And so she went back to Ontario and passed away. There was a story in Britain of the young 6-year-old chap who had serious cancer, and he couldn't get treatment under the National Health Service. His parents, the Kings, took him to Spain. They were arrested for doing that because, in fact, the family doesn't have control over your children. The government controls your children. He did get his cancer treatment in Spain, and this young chap is still alive today. But if they had not done what was illegal and gone to Spain, he probably wouldn't be alive today. There are just so many stories of people. It's easier to deny care and you to die early rather than paying for expensive treatment. The former Premier of Newfoundland, Danny Williams, when he was diagnosed with a serious heart problem, he was told in Canada that he'd have to go to Ontario and the wait was going to be long and it was harmful to his health. And so he went to Florida, to Mount Sinai Hospital, and had his heart surgery. And when he came back, the Canadian media said, how could you possibly go to the evil United States and pay out of pocket for your surgery? He said, it's my heart and it's my life. I want to remain, it's my choice. And I need
being alive. I like being alive.
Yes, exactly. So we want the way to solve our healthcare issue, which there are some in this country. Universal coverage can be achieved if we have competition and choice. We need to open up the system to a variety of plans and types of programs for people rather than moving everyone into a program run by the government. People don't like the post office. They don't like the DMV. These are the people who would be in charge of your health care.
Yeah, and the family that went to Spain, they kind of treated them like they were homeschoolers. I mean, they really threw the book at them.
Right.
So I actually put on Twitter when I was scheduled the interview that I was going to speak with you, and someone responded and said, hopefully she has better solutions than just the typical libertarian stuff. And it's Twitter, so I don't know what that meant exactly. But since I hadn't read the book, I didn't really know what to say. So I read the last chapter where you talk about an alternative vision for healthcare reform. And there's actually some very interesting things in here that you mentioned need to be done in order to fix our program long term. There's probably 5 or 6 main ones. You want to kind of go through some of your ideas to turning the Titanic around and saving all of our lives?
Right, exactly. As President Trump said in the State of the Union the other night, we will never let socialism destroy American healthcare, but we do need solutions. And so in my book, I talk about how we would achieve a universal coverage using choice and competition. One of the biggest problems in American healthcare is the fact that it was the federal government that provided employer-based coverage during World War II when wage and price controls were in. Employers couldn't offer more money to attract new people, and so the government allowed employers to write off the cost of their health care. Employees in this country get their health care tax-free. We have about 180 million Americans who have employer-sponsored coverage. The problem is that if you lose your job or you quit your job, you go into the individual market, you have to buy your health care with after-tax dollars. We really need, I would love to get rid of this employer-sponsored coverage, but in the meantime, we need to allow individuals to deduct the cost of their care so that it's tax-free in the same way that Americans who have employer-sponsored coverage do. We need to expand health savings accounts. About 21 million Americans today have health savings accounts. Even employers now offer them. It puts doctors and patients in charge. You can use your HSA for various payments. You put the money away every month in your account. You carry it forward tax-free, and it has to be combined with a high deductible, what we call a catastrophic plan. People should be able to use their HSA to help pay their premiums if they need help, if they're in the individual market. People who are over 65, if they can afford it, they should be able to continue to contribute to their HSA that they can't right now. We need to bring about price transparency in the healthcare market. That is an important thing. People need to know what various treatments will cost, and if we have transparency, it will help to bring down the cost of healthcare. You mentioned retail clinics. Retail clinics are a great idea. It opens up the system. Many young families use retail clinics when their children get a sore throat, an earache, or whatever. We need to expand that option as well. We need to make Medicaid, the program for low-income Americans, anyone earning under 138% of the federal poverty level, about $19,000 a year. We need to give people on Medicaid health opportunity accounts so that they can feel good about themselves. They can get coverage that is outside the government system. I think we need to raise the age of Medicare from 65 up to, you slowly raise it, because when Medicare came into being in 1965, the average age of people's living was 65. Today it's 79. And so, this is a tremendous cost, as we talked about earlier on the Medicare program. So raise the age, make it needs tested.
People essentially live 1/5 of their life approved now in Medicare, whereas before the average age was 65, which means probably most men didn't even make it that far, right?
Right, exactly. And we need to do tort reform. Remember when President Obama was pushing Obamacare, he said that, doctors, do all these medical tests to line their pockets with extra money. Doctors practice defensive medicine, particularly OBGYNs, neurosurgeons, various specialists, because they are afraid of being sued. The cost of defensive medicine in this country, according to PricewaterhouseCoopers, $210 billion a year. We need to cap non-economic damages in this country, and we need to, so that, at $500,000 a year. This happened in Texas, and many doctors went back into Texas, as many doctors can't afford the insurance, the medical malpractice insurance, and so it has caused people to leave medicine. So we need to cap punitive and non-economic damages, and this will help to reduce doctors doing expensive testing that may not be necessary.
And then there was one, you mentioned the HSAs. This hit me pretty hard because you mentioned Michael Cannon at Cato said that because the after-tax dollars that I would spend for healthcare might be more expensive than the pre-tax dollars you would spend, that we should be able to contribute to the same limit. Whereas right now the HSA is $7,000 cap for families, it's $16,000 on employer-sponsored insurance. Little things like that I hadn't even really considered. Why can't I have an unlimited cap on my Medicare spending? Like in Singapore, where Dr. Flynn says there are people who have $20,000, $30,000, $40,000, average people who have it because it rolls over every year and there's no cap.
Right.
And now there is no medical emergency that leaves you dying in the street or fearful of losing your job. The most common refrains we hear about why we have to have Medicare for all. So There's so much good stuff in here. You crammed a lot into this actually pretty small book. So I'd encourage everyone to go out, read False Premise, False Promise. Sally Pipes has written several books on healthcare, and I'm starting to wonder as I look through the titles, do you ever feel like you're losing the battle? I mean, can we win this? I look at someone like Bernie Sanders and I go, how does someone feel like he has so much to gain from human suffering? I'm fearful of what happens in 10 or 20 years if he gets his way. Why is it so hard to see? Why are we even having to discuss this at all? This would have gotten laughed at 30 years ago, and here we are.
Right, exactly. Well, he started his plan pushing Medicare for All when he was running in 2016 against Hillary Clinton for the Democratic nomination. He didn't win, but it gave him the sort of tailwind to start really getting on the program. He's introduced a Medicare for All bill in 2017 in the Senate, in 2019. And now that he's one of the front runners in the campaign, he's really pushing this. I think, I wouldn't be doing this if I didn't think it's so important for me to educate the American people on the disastrous effects. He doesn't want to talk about the cost. He doesn't want to talk about, in a country like Canada or England, you can't go to a specialist. You have to be referred by a general practitioner before. He says there would be no referrals. This would just cause an even greater cost on healthcare than the $30 to $40 trillion over 10 years. The demand would be, out of control, and people would be very upset. Because if you look at a single payer system, we do have one in this country. It's the Veterans Administration. And look at the stories, the horror stories that are in the media virtually every day because our vets are on waiting lists. They can't get access to specialists. They can't get access to the latest treatments because they're not on the formulary. People need to look at this. The Senator Sanders, telling people healthcare would be free. Well, everyone thinks, well, if it's free, it would be a great idea. The latest poll from Kaiser Family Foundation shows that 56% of people support Medicare for All, 68% support that the public option. But if you tell people it would mean you would lose your employer-sponsored coverage, support goes down to 37%. If you tell people their taxes would increase significantly, their support goes down to 37%. Sanders tells people the Canadian healthcare system is free. Of course it's not free. Canadians pay $13,311 every year in hidden taxes for a healthcare system that puts them on a waiting list and rations their care.
The more they know. It's kind of like the healthcare bill. They're gonna have to sign it to figure out what's in it, and they're not gonna like it.
Right.
Ladies and gentlemen, the wonderful Sally C. Pipes. Please go out and buy her book. I don't know if you're on social media, but please follow her, pick up, and please study and learn what's in here. People are not going to like what they find out. Thank you so much for your time, and best of luck with your book.
Thank you. Thank you so much.
Yeah, come here, babe. Oh, what you got? Hey, come here. Oh, look at the camera. Hey, what's that? Say, please subscribe.
Please subscribe.
Yay! Say bye-bye. Say bye-bye.
Bye.
Bye-bye. Bye-bye. That was fun. Good job.